So despite the fact that CD19 CAR T-cell therapy has changed outcomes in patients with relapsed refractory large B-cell lymphoma, and a lot of these options have turned out to be curative, a substantial portion of patients will relapse after CAR T-cell therapy. Most of these would be CD19 negative as a mechanism of tumor escape. And as a result, at the University of Colorado, we developed a bicistronic CAR T-cell therapy construct incorporating CD19, which encodes a CD28 co-stim domain, and CD22, which encodes a 4-1BB co-stimulatory domain, leading to co-expression of 19 as well as 22. This has been individually validated in the preclinical models, which showed T-cell expansion and CAR expression. And thus, at the University of Colorado, I, with my colleagues, have led a phase 1 3+3 study of safety and tolerability of a bicistronic CAR, which is CD1922, in patients with relapsed refractory non-Hodgkin lymphoma. Patients with mantle cell lymphoma are also eligible. Large B-cell lymphoma eligible provided they have progressed after 2 or more lines of treatment. Prior CD19 CAR is not an exclusion. However, it is mandated that the tumor expresses CD19 as well as 22. At this point in time, over the last 2 years, we have enrolled a total of 9 patients, of which 1 was treated off protocol on compassionate use. So in terms of efficacy-evaluable patients, we have 8. We have so far gone up to dose level 2, dose level 1 starting at 3.3 times 10 to the 5, and then dose level 2 at 1 million. With regards to safety, with regards to demographics, patients have been highly pretreated. 100% of patients had stage 3, stage 4 disease. 1/3 of patients had high tumor burden disease. 1/3 of patients had received prior bispecifics. 1/3 of patients had received prior CD19 CAR T-cell therapy. And 1/3 of patients had actually received prior CD19 as well as prior bispecific agents. 79% of patients were refractory to prior range of treatments, which underscores the heavily pretreated population that we enrolled on this study. With regards to safety, we have seen good safety signals. At dose level 2, we saw 4 cases of CRS, all low grade, and at dose level 2, we saw 1 case of ICANS at low grade. There were no grade 3 or higher CRS and ICANS seen on this study yet. However, we have seen 1 grade 5 hemophagocytosis that has eventually led to patient death, and subsequently our protocols to monitor this complication has been bolstered with early onset with early institution of tocilizumab as well as anakinra in eligible patients. With regards to safety, 8 patients are efficacy evaluable, and of the 8 patients, we have seen 2 patients who have had a complete response and 1 patient who has had a partial response. At this point in time, the early data looks safe as well as efficacious and promising. As a result, we continue to robustly enroll on this study, and we look forward to presenting updated data at future meetings.